Welcome to the 2017 National Healthcare Safety Network NHSN Quick Learn series. These are brief and informative presentations from the Centers for Disease Control and Prevention. They serve as an educational resource for healthcare facilities working to prevent healthcare-associated infections, or HAIs. In this Quick Learn, we provide new users with an introduction to NHSN Data Analysis, specifically focusing on CMS reports. We educate new users on the utility and significance of data analysis. We provide guidance on how to approach basic data analysis within the updated NHSN application. New users learn how to navigate the updated site to generate datasets and access the analysis reports. This presentation demonstrates how to execute and customize reports for a given healthcare-associated infection, HAI type. Lastly, we discuss how to understand and interpret the analysis results.
Why is analysis important? To begin unpacking this question, we need to understand that data is a form of currency, in the sense that it holds limitless value. It would be a disservice to collect data simply for the sake of storing data. In order to maximize the power of data, we have to dig deeper to uncover its utility and significance through the process of analysis. Analysis helps us to understand and break down our data. Through the NHSN Data Analysis tools, you are encouraged to take full ownership of your facility's data and build a narrative around it. It can also be used to highlight areas that your facility excels in, as well as areas that could potentially use improvement. This ties directly into understanding how well your facility is performing in its prevention efforts. The analysis tools also serve as a way for you to perform quality assurance by conducting internal validation to promote accuracy. Your facility's data may potentially be used by the CDC, the State Health Department, CMS, special study groups, etc. So it's important you understand your facility's metrics. Lastly, be proactive by using your data to take action. Allow the data to be a source of empowerment, not discouragement. The first step in performing data analysis in NHSN is generating datasets. Once you are logged in, this can be accessed by selecting the Analysis tab on the left-hand side and clicking Generate Datasets. Keep in mind that the default time frame of the dataset is the 3 most recent full calendar years, so make adjustments if needed. Once you are satisfied with the time frame selection, proceed to select Generate New. Generating datasets copies and freezes the data specific to your individual user account. This process takes a few minutes, but you can access other areas of NHSN or log out while it completes this process. The data used for analysis is a frozen copy, so if you make any changes within NHSN after you generate datasets, it will not be reflected in any of the reports until you generate datasets again. In order to access NHSN reports, navigate to the left-hand side and select the Analysis tab. In the drop-down, select the Reports option. Take note of when the last dataset was generated to ensure you are utilizing the most recent dataset for your analysis. The Analysis Reports page is the central hub for running NHSN reports. The data analysis options are organized into folders that house subfolders and reports. You have the option to expand or collapse one or more folders at a time. Although we will be focusing on CMS reports in this presentation, the basic steps to run and modify reports can generally be replicated for other types of reports. The CMS reports within NHSN will include the data that will be sent to CMS for the quarterly deadlines and are applicable to the selected quality reporting program and HAI measure according to the rules required for completion of those data. More information can be found in the resources listed at the end of this presentation. Under the CMS Reports folder, select the subfolder with your appropriate facility type, such as acute care hospital, critical access hospital, etc. Within that subfolder, navigate to the desired healthcare-associated infection, HAI, type for your analysis. For the purpose of this presentation, we will be acting as an acute care hospital interested in examining central line-associated bloodstream infection, or CLABSI data. Once you select your desired report, you will have three options. You can either run the report, modify the report, or export the dataset. Select the Run Report option if you do not need to customize the report by any specific parameters. If you are interested in tailoring your report, select the Modify Report option and a new window will pop up. This new window will allow you to modify certain criteria, such as the report format and the time period. The Title Format tab allows you to change the title of your report, as well as modify the output format. You also have the option of showing descriptive variable names by selecting the respective checkbox on the top left. For further customization, the beginning and ending time period can be adjusted to stratify by one of the 4 date variables in the drop-down option. The Filters tab gives you an opportunity to create additional rules for your output. This allows you to set inclusionary and exclusionary criteria for your output. For example, you may only be interested in looking at neonatal ICUs in your analysis, so you would filter this report by the variable location type. Of all the tabs, this is where the heart of customization lies, because there are a variety of variables that can be utilized to customize your report. Keep in mind that the more filters you add, the less output you will also have, because each additional rule narrows down your data. Within the Display Options tab, you are able to adjust the Group By variable according to your preference. For the purposes of CMS reporting, the data is summarized on a quarterly basis, so that will be the default option. However, this can be adjusted to fit your reporting needs. Once you have finalized your modifications, you can choose to either run, save, or export your report. Please remember to save a hard or electronic copy of your data prior to the CMS quarterly deadline. This is to ensure that you are aware of the data that will be sent to CMS on behalf of your facility. Once you have ran your report, you will generate tables that look identical to these, assuming your output is in HTML format. You will notice the first row in the first table on this slide includes different elements, such as organization ID, the location type, and the Group By variable. Each table in your report may include slightly different sets of variables, so keep that in mind as you move forward with your analysis. In the first table, let's look at the infection count and the number of predicted infection variables. These are very important variables because they are the figures used to calculate your standardized infection ratio, or SIR value. The infection count is the numerator and the number of predicted infections is the denominator. The SIR value is the summary measure used to track healthcare-associated infections over time. This measure is risk-adjusted for facility, location, and/or patient-level factors, depending on the HAI you are measuring. So using the 2015 baseline, if a facility has an SIR value greater than 1, that would indicate that there were more observed infections than predicted, based on the national 2015 data. Likewise, if a facility has an SIR value lesser than 1, this would indicate fewer observed infections than predicted, which indicates some prevention progress. In the first table, we can see that the SIR value for the CC location type in the first quarter of 2015 is 2.249, which indicates that the facility has more observed infections than predicted. We can cross-check this by dividing the number of observed infections in the first quarter of 2015, which is 4 for this facility, by the number of predicted infections, which is 1.778, and we derive the same SIR value of 2.249. In the second table, we notice that in the third quarter of 2015, we do not have a calculated SIR value. This is because the SIR is only calculated when the number of predicted infections is greater than or equal to 1. Please make it a practice to pay close attention to the footnotes whenever you run any reports, because they contain useful background information about the data contained in the report. There are 2 measures that indicate whether your facility's SIR value significantly differs from the nominal value of 1, which represent that the number of observed infections is equal to the number of predicted infections. The p-value is the probability value used to determine whether a significant difference exists between your SIR value and the nominal value of 1. For NHSN purposes, we use 0.05 as the agreed-upon standard of determining significance. This means there's a 5% chance that the difference between the 2 values is due to random chance. The difference is considered significant when the SIR p-value is less than or equal to 0.05. In this particular example, the SIR p-value is less than 0.05, so this would be considered a significant difference. Furthermore, the difference is considered significant whenever the 95% confidence interval is not inclusive of the number 1. In other words, when both the lower and upper bound are either less than 1, as is shown in this example, or greater than 1, then there is a statistically significant difference. As indicated in this example, the range does not include 1, which means we are 95% confident that the true SIR lies within this range. As you become more familiar with the NHSN application, you will quickly learn that it will serve as a great tool to perform internal validation. Specifically, the reports can help to shed light on any areas where there are discrepancies or inconsistencies. For example, this facility has all 3 months of data reported for the first quarter of 2015. However, for the fourth quarter of 2015, there is only 1 month of data reported for this facility, so this could potentially be an area of concern. Please always cross-check your data to ensure that there are no issues or discrepancies. In order to promptly identify any issues, we recommend running reports on a regular basis so that if any issues arise, you can resolve them quickly and before the CMS Quality Reporting Program deadline. For additional information, Please refer to these resources regarding the SIR guide, the 2015 baseline, and more in-depth analysis training. For any additional questions or support, contact our support team at nhsn@cdc.gov.